The cancer situation in Africa is disheartening, and that's the message from the World Health Organization's Regional Director for Africa, Macedo Moeti. The WHO estimates that the annual cancer deaths on the continent are projected to reach 1 million by 2030. In 2 decades' time, death rates in Africa will overtake the global average of 30%. Statistics that Dr. Moeti termed a wake-up call for governments. She explains that cancer survival rates in the WHO's Africa region is currently 12% on average, significantly lower than that of 80% average in richer countries. Half of the new cases detected among adults in Africa are breast, cervical, prostate, colon, and liver cancers. As the world marked World Cancer Day on Sunday, Moeti also recognized the progress made in cancer prevention and care. She hailed the 17 countries that have introduced high-performance-based screening tests for cancer, with 28 countries carrying out vaccination programs for HPV, an infection that can lead to cancer. Well, to discuss this further, we are joined by Dr. Gladwell Kiari, a medical oncologist based here in Nairobi. Doctor, welcome to the program. Thank you for joining us here on Africa Live. Doctor, World Cancer Day was marked yesterday. What is the status of cancer across Africa?
Cancer is indeed a major cause of mortality and morbidity in Africa. And as you said, over 800,000 patients are diagnosed, and over half of those are dead in the first year. And this is because of the late presentation of the disease. Most patients in Africa come with stage 3 or stage 4 cancer, which is usually more difficult to treat. The treatment intention is usually palliative, and it's very expensive for households to treat an advanced cancer patient because of the support they need. And the fact that they no longer can earn their daily bread also gets very difficult. As we challenge governments this year to close the cancer gap so that there is equal care given to patients as far as access is concerned, in spite of the disparities, the social economic disparities, the geographical disparities, we must push governments to offer care to cancer patients in Africa. And this can be done by changing some of the policies so that there are more cancer treatment centers, more women, especially as alluded, the biggest numbers are in breast and cervical cancer. There needs to be access to radiotherapy and chemotherapy facilities. These women and men need to have health insurance to be able to afford these treatments and to be able to access also the supportive services